Okay, hi everyone. This is our career documentary for Uni 101, and we'll be going over our chosen careers and what we have to do in order to achieve success. So first of all, what a successful future looks like to us would be that we realize everyone's definition of success can vary, and that my definition of success could be very different from everyone else's, and that it's important to just set your own goals and aspirations, because no matter how you achieve them, you should be proud of yourself. And we believe that we can achieve our goals with a strong sense of self-efficacy and grit, because we know that as long as we believe in ourselves, anything is possible. And so my chosen major is nursing. And a few questions that I had when I was looking into nursing at UNCW were, what are the requirements necessary? What are some career options after graduation? What does a typical day look like for a nursing major? And is it a common job? And then, as you can see, this is actually a photo from UNCW, College Health and Human Services, the School of Nursing. And so the reason why I decided to get into nursing was because I've always been incredibly passionate about helping people. And as a nurse, I realized that I will enjoy going into work every day, knowing that I made a positive impact on my community. And I also learned from the Journal of Advanced Nursing, which was a scholarly article, that nursing is a growing career and that it will always be needed within society, because unfortunately, people will always be getting injured and sick, and somebody will always be needed to help them. And so when I heard about UNCW's nursing program, I understood that it would be very competitive and challenging, but despite the demanding workload, I believe that something I'm this passionate about would be worth it in the end. So admission to the UNCW nursing program, it's very competitive, but with a combined GPA of 2.7 from all institutions that a student has attended, they would be able to get in. But in order to be competitive for the program, you should really have a 3.9 to a 4.0 GPA. You also need completion of the TEAS assessment. And to be competitive, to be considered to get into the program, admission says you should score about an 85 or higher. And in order to be eligible, you need to complete Chem 101, Psychology 105, a Sociology or Economics course, a Biology course, or a math and statistics course. And as you can see, there's a lot of different options for what you can choose from. And all of this was provided by the UNCW Career Center. So some career options in nursing for anyone would be an emergency surgical nurse, a trauma nurse, a neonatal nurse, oncology, spinal cord injury nurse, nurse researcher, hospital administrator, or an ambulatory care nurse. And there's so many more options than that. And this was just a few that was listed on the UNCW Career Center website. And personally, I don't know exactly what I would want to get into, but when I look into the future, I see myself as either a trauma nurse or an emergency surgical nurse. But obviously, after admission into the program, there's so much more I need to learn and to see what I thrive best in. And then also after nursing, I could see myself potentially becoming a physician's assistant, but that would take more schooling. And just one step at a time, I realized that in order to achieve any of my goals, the first step is to be admitted into the nursing program. And I'm not sure where I'd want to work when I'm older, but as you can see, nurses are found all over America, all over different countries. And like this picture is from the Seattle Times. Nursing can take you so many different places in life, and I'm excited to see where I end up.
So I'm also a nursing major. A few things I'm going to talk about is why I chose my major, what a typical day looks like for a nurse, and my career path. So the reason why I chose nursing is because in my middle of my high school career, I lost my grandmother from breast cancer. She was really close to me, so definitely felt it. So it maybe pushed myself to go do nursing, because I maybe realized I really want to help people, make a difference to others, and I originally wanted to do engineering, but that drastically changed when she passed away. And the reason why I chose the UNCW was all my friends that I was in my CNA class told me they're all going to Wilmington, and I was going to go to UNCC because it was close to home. And then my UCNO program, they all talk about Wilmington, and I did my research and I fell in love with the campus and everything about it, and went on the the UNCW nursing website. Wilmington was named a 2021 National League for Nursing Centers of Excellence, so it played a big part of my decision of coming here. And then for a typical day for a nurse, there's a lot of responsibilities for nurses, but mostly you're going to be assigned a number of patients and you're going to spend 30 to 40 minutes helping them and doing whatever your task you're doing, which could be like vital signs, giving medication, giving shots, and basically what you're all going to be doing. And you also have a lot of office work, so you're filling out paperwork that doctors give you, and you're just um, like looking back at family history and then going from there and see like the best way to take care of a patient is. And then another nurses are often the people who talk to the parents and the kids and stuff and share the information that doctors give them. And then as of right now, my career path is to go graduate from UCW with my degree and then go work as an ER nurse because I like the rush and I think it'd be really cool. And then eventually go back to school for respiratory therapy and then become a CRNA.
All right, let's see. And then for mine, I chose recreation therapy as a major. Some of the questions I had whenever I was first looking at this major was, what is recreation therapy? What credentials do recreation therapists need? What skills are needed for recreation therapy? What are the responsibilities of a recreation therapist? And then what is the typical work setting for recreation therapists? So first, recreation therapy is simply therapeutic recreation. It is a systematic process that uses recreation and other activity-based interventions to address and assess needs of individuals with illnesses and or disabling conditions, as a means to psychological and physical health, recovery, and well-being. I have two brothers and sisters. One he has like a disability to where he can't walk at all. And so I kind of grew up doing physical therapy with him pretty much all of his life. And then my sister, she also has a mental disability, and like seeing the way that going outside or like just going for a walk or like playing a sport really just helps her like cope with things, and like being able to be a part of that is like one of the main reasons that I wanted to do recreation therapy. And then what are a recreation therapist's credentials? A qualified recreational therapist is someone who is nationally certified as a certified therapeutic recreation specialist, CTRS, usually referred to as recreational therapist. Qualified professionals are certified through the National Council for Therapeutic Recreation Certification, NCTRC, which requires a bachelor's degree or higher from an accredited university, a formal internship, and the passing of a national certification examination. A CTRS must maintain their credential every 5 years through the NCTRC recertification process, basically meaning that in order to be a recreational therapist, you have to take an exam every 5 years just to make sure that you still know everything that you need to know. Academic programs in therapeutic recreation or recreational therapy emphasize coursework in the physical, biological, and behavioral sciences in recreation and leisure. And then what skills are needed for recreation therapy? You need to have motor skills. You definitely need to have a lot of patience. As I mentioned before, growing up with like my sister, we're around the same age, and she does have quite a few like mental disabilities. And so seeing my mom and like the way that she had to have a lot of patience, um, definitely is something that you'll need to have. You'll need to have persuasiveness, creativeness, leadership, physical coordination, communication skills, and planning skills. And then what are the responsibilities of a recreation therapist? You need to be able to determine patients' needs during using observation, medical records, tests, and discussions with other healthcare professionals, patients' families, and patients. That's where the communication skills come in. We need to be able to create treatment plans and programs that meet patients' needs and interests. You need to be able to plan and implement interventions to support the client in meeting his or her goals. We need to be able to engage patients in therapeutic activities such as exercise, games, community outings. We need to be able to teach patients. That doesn't make sense. I need to fix that right here. We need to be able to teach patients and help them learn social skills needed to become or remain independent. And we need to be able to help patients learn ways to cope with stress, anxiety, or depression. And then we need to be able to document and analyze a patient's progress, evaluate interventions for effectiveness. And then what is the typical work setting for a recreation therapist? Recreational therapists work in a variety of settings, including hospitals, nursing homes, and government parks and recreation departments. Most therapists work full-time. Recreational therapists held about 2,800 jobs in 2020. In the year 2020, about 36% of recreation therapists worked in hospitals, state, local, and private. About 16% worked in government facilities. About 13% worked in nursing homes or nursing care facilities. About 14% worked in social assistance, and about 7% worked in ambulatory health services.
So for our interview with a professor, it was with a Professor Arante, who's a sociology professor here at UNCW. And even though none of us are necessarily planning on going into the major of sociology, at least for nursing majors, sociology is a requirement. And also along with respiratory therapy and anything really in the medical field, you need sociology is similar to them because it's just how people relate to each other in the study of people. And obviously when you're working with people, understanding these interactions can be really helpful. So this is just a short interview about Professor Arante's career and how she ended up here. And it also shows that even though you might have one plan originally, your career path can always take you to different places. So like she did not expect to be a sociology professor, but that's just where she ended up.
Yeah. Okay, awesome. So in terms of my career path, I actually in undergrad when I was at Chapel Hill, I was not sure what I wanted to be when I grew up. I come from a family of educators, both in K through 12 and in college. And so I always had a lot of respect for teachers and the career field as a whole, but I was never quite sure exactly what direction I wanted to go down. And in college, I studied business management in Spanish. So to answer, the short answer is no, I didn't know until grad school when I started studying sociology beyond the undergraduate level that I absolutely loved teaching about sociology and lecturing about sociology. I've always loved kind of teaching, working as a surf instructor and doing some tutoring and working as a soccer coach. I loved all that teaching components in my life, but it wasn't until grad school that I really started visualizing becoming an instructor of sociology, specifically in higher education.
Okay, thank you. What is your favorite part teaching about sociology? What's your favorite aspect of it?
Oh, wow. That's a great question because there's a lot of different things I really enjoy. I really enjoy teaching intro courses with the opportunity to introduce students for the first time to sociology. And there's so many wonderful things about teaching higher level courses as well that I also enjoy. But I think for me, kind of seeing that moment where students recognize what they can take from my class and apply, outside of just the walls of our classroom, kind of starting to see sociology, if you will, around them. That for me is an exciting moment because I remember my first intro course and I remember the additional sociology courses I took, a few in undergrad and then especially in graduate school, those instructors that really had an impact on me on basically seeing the world differently, because that's a lot of what sociology is about, is that entire lens. And I love helping students to form that lens, not only through the content, but through applying it as well.
Okay, thank you. So like
Uh-huh.
after learning so much about sociology, do you think you view the world differently because of it before you learned so much about it?
Absolutely, and I guess that kind of goes goes in the same direction that I was just discussing. Sociology and our sociological perspectives not only has helped me to understand our society better and all the data on our society, but I think one of the beautiful things about sociology is it helps us understand our own lives better. And it's helped me to kind of gain new insight by studying sociology on the behaviors and the social norms and, the family dynamics and friend dynamics and social groups and everything that surrounds me on a daily basis. I can kind of use my sociological imagination to gain new insight into both the micro and the macro of society.
Okay, perfect. So I just have one more question. And it's because I would like to get into the nursing program. And so how do you think that by taking this class, it can help students in the nursing field, because you interact with all these different groups of people? Do you think it's because of that?
Absolutely, that's one part of it. That's such a great question too, because some of my closest friends work in nursing. Actually, my college roommate for all 4 years, she's a nurse and she's a nursing professor here at UNCW. So we talk a lot about sociology and the value in the nursing field. And my husband works as a healthcare provider as well. And he always says, every healthcare provider should have a sociology course. And I agree, because I think that in any field that healthcare, especially whether it's nursing or athletic training or whatever field you're going into, you're going to work with a lot of different people, and being able to understand all of the differences in culture and social norms and family structures, as we talked about today, even kind of navigating some of the different cultural conversations on different pharmaceuticals and drugs, as we talked about a little bit in chapter 6 with deviance. There's a lot that you can take certainly from an intro to sociology course and be able to apply it within your nursing career.
Wait, thank you so much. This has been really great. Thank you for your
All right, so that kind of concludes everything. Here's our works cited. And we use popular and scholarly sources. And if you guys have anything else to say.
I think I'm good.
All right, thank you.